This week is Get Smart About Antibiotics Week, and as we head into flu season, everybody seems to be getting sick, and it can seem like a round of antibiotics are the answer, but that is not always the case. And joining me now, Dr. Elizabeth Meade, a pediatrician at Swedish. Great to have you once again this morning. Always good to have you. So let's say my kid has a really bad cold. I want antibiotics. I want this thing gone. That's not always the best choice, though.
Absolutely. I mean, I think parents want their kids to feel better right away. That's normal, and we want them to feel that way. But antibiotics are not always the answer, and in fact, the vast majority of infections that children get are viruses, and so antibiotics actually won't help at all.
Really? Okay, so, but a really bad cold can turn into a bacterial infection, in which case you'd probably want to get on some antibiotics.
It can. So sometimes if kids get a virus, it can turn into a bacterial infection. So if your child has been having kind of minor cold symptoms and then suddenly several days in, they're getting really high fevers, they're feeling much worse, then it's a good idea to go get checked out by the doctor.
Now, there is a real danger. I think a lot of us by now know that overuse of antibiotics can be a really dangerous thing. Can you explain why?
Sure. So there are personal reasons just based on the person taking the antibiotics, and we can talk about side effects a little bit later. But also, as we're using more and more broad spectrum antibiotics for various infections, we're seeing a lot of bacteria that are developing resistance to some of those, and then it's very difficult to treat them.
So I've had, my kids have ear infections. I take them in. They are given antibiotics, and it clears right up, which is fantastic.
Yeah, so I think the thing about ear infections is that we know from studies and from examining kids that most of the time they actually get better on their own. So if they truly have a bacterial ear infection, there are certain cases where we would treat those kids. So kids who are under 2, kids who have ear infections on both sides, really severe pain, history of hearing loss, or other underlying conditions, then we would typically treat those with antibiotics. But the vast majority of ear infections will go away without any treatment at all.
If my kid has a nagging cough and it's been kind of lingering for a week or so, or the sniffles just won't seem to go away, is that a good time to go to the doctor and say, hey, maybe can we look into this?
It's fine to get checked out by the doctor at that point. I think it's really important for parents to know that just straight up cold viruses can last for 10 to 14 days in terms of symptoms. So don't be really worried if your child is still having some nagging cough or runny nose. If they're generally on the upswing and they're kind of starting to feel better, then I would usually just watch and wait.
Okay, so let's say our kid's on antibiotics and we're watching them and we're noticing some differences. What are some potential side effects of antibiotics?
Yeah, so diarrhea is probably one of the biggest ones, and it can be really hard on kids, and they can actually get pretty dehydrated from it. Children can have allergic reactions to antibiotics, just like any other medication. Those are probably the 2 biggest ones that we worry about.
Okay, so what questions should I be asking my doctor when I am prescribed antibiotics for my kid?
Yeah, I think there's still a lot of over-prescribing that goes on. So I think it's always important if your child is being prescribed any medication to ask the doctor, what are the side effects? What do I need to watch out for? How long do we need to continue the medication? And then to really say, do we need to start it right now, or can we watch and wait and see if the child starts to get better on their own?
A lot of times the doctor will say, be sure you finish this entire bottle or this entire dose. Why is that?
Yeah, great question. So if we are treating an infection with antibiotics, what we don't want to do is partially treat it, because then it can come back later, and it can come back with bacteria that have actually developed a resistance to that antibiotic. So if you are prescribed the medication, it's really important to finish that whole course that the doctor gives you.
Gotcha. Listen to the doctor. Listen to the doctor here. Dr. Elizabeth Meade from Swedish. Great to have you once again. And by the way, you can find more information on their website.